is Taylor Penland. Today I'm going to be performing a head, ears, eyes, nose, throat assessment. This is my patient. He has agreed to let me do my assessment on him. So I have already performed my hand hygiene, provided privacy by bringing him into this space. I am first going to inspect his overall appearance, and he doesn't look disheveled. His skin looks like it's in good condition. There is no yellowing or paleness. He looks very pink in overall color. I'm going to first start by having him take off his hat for me. And then I'm going to just palpate to make sure that there are no indentions or abrasions on his head. And so it feels very normal. He has a normal indention for his occiput back here, but other than that, it feels very normal. From there, I am just going to palpate his temporal artery, so I'm going to have you remove your glasses for me. Okay, and so I can feel his temporal artery. From here, I'm going to move to his TMJ joint. I'm going to have you open and close. Thank you. And then I'm going to move to his sinuses. So I'm just going to press gently on here. Do you feel any pain?
No.
Okay. I'm going to have you open. Okay. So all of his joints and his sinuses feel normal. From here, I'm going to go ahead and assess his lymphatic system on his face and his neck. So I'm just feeling for his different lymph nodes. While I'm here, I'm going to palpate his carotid on either side just to make sure that there is adequate blood flow. Okay, so after palpating his carotid, it seems like he's got adequate blood flow going through either side. His lymph nodes seem to be within normal range on his head and face, as well as his neck. So from here, what I'm going to do is just assess the overall appearance of his ears. So just from looking at them, there doesn't seem to be any abrasions. There's no leakage. Now, if I were in a setting where I could have an otoscope available, we would look in his ears to see if there's any reddening instead of that pearly gray appearance. I'm going to go ahead and look at either eye and note if there's any drainage, which there is not. I'm going to look at his nose and see if there's any drainage. There's no abrasions either. I'll have him open his mouth, and then I will assess his teeth, which look to be in normal condition. His mucosa seems to be moist. His gums are pink, so there's not an issue there. I am going to have you go ahead and stick your tongue out and say ah. So his uvula looks to be in good positioning. His tonsils look to be about a grade 1 to 2. And then I'm going to go ahead and perform a PERLA assessment on him. I don't have a pen light on me, so I'm just going to be using my cell phone. And so what I will have you do is I'll have you look straight ahead at me. I'm going to shine this light into your eyes twice on each side, okay? So I'm looking for the pupils to be round, equal, and reactive to light, which they both do. And so from here, I'm going to just pull his eyes down so I can see his tissue below his eyes, which they seem to be pink, so they're not gray in color, which is good. His sclera seem to be white. They don't have any yellow tints to them. So now what I'm going to have him do is move his neck from either side. I'm going to have you move it from front to back. Are you having any pain when you do that?
No.
No. Do you have any issues as far as holding your neck up on one side or the other? Or do you feel like it's pretty symmetrical?
No, it's good.
Okay. So now what I'll have you do is I'll have you stand up. And this is the hearing portion of the exam. So I'm going to have you face away from me. And then I'll have you cover one ear. I'll have you put your index finger inside of your ear. Okay? And I'm going to give you, I'll have you take it down for just a second. I'm going to give you a sequence of numbers so that you can repeat them back to me.
Okay.
Okay, so go ahead and put your finger, cover your ear. 1, 2, 3.
1, 2, 3.
Okay, and then I'm going to have you switch sides. 10, 9, 8.
10, 9, 8.
Okay, so good job. I'll have you sit back down. And then that concludes our examination for today. Thank you for watching.